Hello everyone, I'm Lou Beccaria, your host for the Health of It. I'm happy to say that we're back on the air again with an array of new shows after a hiatus of several months. We'll be broadcasting our new shows from the wonderful TV studio of Phoenixville Area High School with its new green screen technology that'll enhance your viewing pleasure, I'm sure. My first guest to kick off this new series is Susan Graham, the Director of Marketing and Communications for the Phoenixville Hospital. Susan will be telling us about the relatively new partnership of the Phoenixville Hospital with the nonprofit Tower Health System, the new owner of the hospital since the fall of 2017. Susan will be bringing us up to date on happenings at the hospital since Tower Health became the parent owner of the hospital. We'll be covering such things as the healthcare philosophy of Tower Health, the new clinical affiliations it has initiated, new facility improvements, staffing enhancements, and more. So without further ado, let's get into the show. Susan, welcome to the show.
Glad to have you here. Lou.
It's very exciting to have Tower Health as a part of our community and as owner of the hospital now.
I know, we're so excited to be part of this community. So I actually joined the Tower Health family in April of 2018, sorry. Gosh, I'm dating myself. But it's been a wonderful experience to get to know everybody in Phoenixville, and I have to say this community is amazing. The support of all the nonprofits, it's been wonderful to get involved with.
It's a very unique place, Phoenixville is, that's for sure.
It's a very unique and special place, I will say that, and the hospital is very happy to be part of a lot of the community activities out there. I mean, we're just in everything, I feel, so it's wonderful.
Well, tell us a little bit about your background. I mean, have you been in hospital administration and so forth for a while?
Yes, I've been in healthcare for about 20 years, and I was at several other large area hospital systems in the Philadelphia area. And then recently I was a healthcare consultant for about 4.5 years, and then I was lucky enough to join the Tower Health System recently, and I couldn't be happier. I mean, I think the changes that Tower Health is bringing to this community, other communities in the Philadelphia area, are just for the betterment of all the communities that where we impact.
Yeah. Well, tell us a little bit about your job in marketing and communications. What does all that entail, Susan?
Oh, what doesn't it entail? You know how it is, Lou. We do everything from the traditional marketing where we develop brochures and flyers and events, and we do print ads to the more robust digital ads on websites, to making small videos, to doing social media. We get involved in a lot of press releases for the hospital. I mean, recently, I think I've been doing a press release once a week because we've been achieving a lot of new accreditations and awards and accolades for the hospital. So it's just been an incredible time to be at Phoenixville Hospital. One of my special things is that we brought a Facebook page to Phoenixville Hospital. I know that sounds so antiquated because Facebook's been around for 10 years. And you know, the hospital just launched a page, but the previous owners were not supportive of this type of marketing. I feel it's very important to have a Facebook page because it really connects you to the community right away. And the response has been overwhelming to, you know, the people really liking the page. So I'm very excited about that. And we're also doing a lot more marketing with our sister hospitals. So we do a lot of collaboration between Pottstown and Brandywine and Jennersville and Chestnut Hill hospitals, which is all part of the Tower Health System now, as well as with Reading. But mostly we do a lot more with the hospitals closer to Phoenixville.
A lot of our viewers may not really understand much about the Tower Health System. So could you explain how big it is and what some of the ramifications of the system are?
Sure. So Tower Health was started by Reading Hospital, of course, up in Reading, Pennsylvania. So if no one knows about Reading Hospital, it's a large medical center. It's a beautiful campus. There's about 750 beds in that hospital. So it's a really huge campus. They have a cancer center. They have behavioral health. I mean, it's just, their services are incredible. It's really huge. I mean, the first couple times I went there, I mean, I got totally lost, and you need to. It's one of those campuses where you need the map. Not that you don't need one at Phoenixville Hospital, but at Reading, you really need the map. And the most exciting news is that they're joining a partnership with Drexel Medical School and bringing a medical school to Reading in the next 4 to 5 years. We'll have a complete medical school. So there's a lot of partnerships going on. So what happened in 2017 was Reading Hospital bought 5 hospitals from the CHS health system. And previously those hospitals were for-profit. So when they became those 5 hospitals, when they became part of Tower Health, they turned their status back to not-for-profit, which is a great advantage for the community. So what that means for the average consumer out there or the average patient is all the profits that the hospital make go back into the hospital. They don't go to a stockholder, they don't go to the CEO's salary, they go back into the hospital. Right. So we can provide more services, better equipment, bring in more staff. It's just incredible the amount of staff that Phoenixville has brought in the last year. The last leadership I heard, it was over 100 new employees in the last year since Tower Health has purchased. I mean, it is huge. I mean, people don't think about those numbers, but there's a little impact in every little department. I think the number one impact that has happened is nursing. We've been able to increase our nursing staff. We've also been able to change the way we hire nurses. So going forward, all nurses need to have their BSN, which is, what does that mean to the consumer? It means that you're going to get a better quality nurse. You're going to have someone who's more trained, more educated, and actually she has to continue her education. She has to do her continuing ed every couple years to maintain her RN and BSN status. Same with the medical staff. I mean, going forward, everyone's going to have to be board certified or board eligible, and then they're going to have to be board certified within a certain amount of months. So what does that mean to the consumer? You're going to have a better trained physician. So those who are already on the staff, they're given a certain amount of time to achieve that extra education.
Since you're on the topic of nurses,
yes.
Do nurses have to have liability insurance like doctors do?
Well, the hospital has it for them.
Yes,
the hospital has it for them. So
that's another aspect of being well qualified and well trained and so forth.
Right, so they're an employee of the hospital. So like any physician that is employed by the system, and Tower is employing more and more physicians, bringing them onto their staff. Employed staff. And I hear that there's plans to bring on, in the Tower Health system total, there's plans to bring on 350 more physicians, employ more physicians. Does that mean more physicians are coming into the system? Not necessarily. It means that we're probably buying more.
Practices.
We're buying the practices because a lot of these practices can't survive on their own. So we are buying them, and we're being very aggressive about those.
Susan, is that pretty much a trend throughout healthcare now?
Yes.
Doctors to be employed by the hospitals instead of having their own practices? Yes,
it's really hard for a physician, and I mean any physician that's out there on their own, I give them a lot of kudos, and it's a lot of hard work because they're constantly working, and they have to stay on top of not only their education but tend to their patients, but then they also have to do all of their books. They have to do the payroll, the insurance thing. So more and more are being, going in-house, I would say. So more and more being employed by either Tower Health, Mainline Health, Einstein, any of the big players in the area. They're getting.
In today's world, I guess it gives them the opportunity to just concentrate on medicine and not have to concentrate on owning a business.
A little bit of that. They still have to make their, but I would say also being employed, there's more pressure to, make sure you see a certain amount of patients per day. So I guess there's a good in both with each world that you live in. But you also see a lot of movement between systems with these doctors. Sometimes they'll get employed by one and they don't like it and they'll move on. So, but we're very happy with our staff, and we are bringing on more and more employed physicians. We're currently recruiting for orthopedics and oncology and
Approximately how many physicians are on staff at the Phoenixville Hospital now, Susan?
I think it's around 150 that are active staff, and then there's another that between courtesy and consulting and telemedicine, it gets up closer to 400.
Wow.
So that's.
So what does the courtesy status mean? I've never heard of that before.
So courtesy means that you can practice at the hospital, but you don't buy into the medical staff. You don't pay your annual dues, and you're not working there.
Okay.
And you have to be active staff. You have to work so many hours per month at the hospital, or
Okay.
doing certain number of procedures and pay your annual dues. So. And same with consulting. Consulting is a little different. Like consulting means that you're able to call in to, help on a case and stuff like that. And then telemedicine, of course, is someone who's on our staff, but they usually consult via video screen. So they're not necessarily here. They could be in another state.
Right.
They could be in another country.
Okay. My guest is Susan Graham, who is the Director of Marketing and Communications at the Phoenixville Hospital Tower Health System. We're going to take a break right now for commercial, and we'll be right back, so just stay with us. Welcome back, everyone. For those of you who are just tuning in, we have the pleasure today of talking with Susan Graham, who is the Director of Marketing and Communications for the Phoenixville Hospital Tower Health System. And we're talking about all that's going on with the new arrangement with Tower Health and all the new things and great things that are happening. So Susan, one of the things that I think the Phoenixville Hospital is pretty special in and unique is that the Phoenixville Hospital has a community health outreach and education department. And could you tell our viewers about that and what all that entails?
Sure, I'd be happy to, Lou. Our community outreach program is, of course, directed by Barbara O'Connor, who you know very well. And she has a staff about 4 or 5 right now, and it's constantly growing. They're out in the community every week doing community education. They hit a lot of the schools. They go to a lot of the community centers. They're always at the farmers market, and they're providing health education to the community. They do a lot of programs, a lot of support groups at the hospital, and programs like Smoking Cessation is one of their big ones. They do support groups for breast cancer, for stroke patients, moms and babies, breastfeeding support group. I mean, there's 20 support groups that they have at the hospital.
Wow.
I mean,
Okay.
and the only reason I know that is because Barb asked me to redo all 20 of our flyers, because I'm I have all those great tools
You're
in
the flyer
marketing.
lady.
Right, I'm the flyer lady. I'm the logo police and the flyer lady, and the banner somehow and signage. But she, and I know that one of her team members is always at the farmers market every Saturday in Phoenixville, and then she has one team member who is dedicated to going out to the area schools. So they go to the public schools and the private schools, and they provide health education on nutrition at all of the schools, and really what any of the schools want to talk about, they'll come in and talk about. One of the big things that they're getting involved in is the huge vaping issue here at Phoenixville School District. It's not just at Phoenixville, it's at all the school districts, and it's at the private schools and the public schools. And Michelle Evans actually sits on the committee. And
What is vaping, by the way? A lot of our viewers may not actually understand what vaping is. It's such a relatively new term.
I know, it is a new term, and we've actually updated all of our no smoking signs on campus to say no smoking or vaping on campus. So it's a smokeless, odorless nicotine delivery system. So it's a little cartridges. They kind of look like USB ports that people can puff on or vape on, and it delivers nicotine to the system without being smoke enhancing. You don't have to burn anything, and it doesn't smell like anything. They have different flavors, so the kids and teens think it's really kind of cool looking to have these devices.
Sounds almost insidious.
Yeah, and
in terms of the tobacco companies trying to get people to smoke.
Well, the tobacco companies tell you that it's a more sophisticated way of getting your nicotine, or they spin it all the different ways.
different
You know,
way,
the
yeah.
marketing people, but there's, they started with one company, and now there's probably like five different companies out there that have these devices. From what I understand, these little cartridges have multiple packs worth of nicotine in one cartridge, and so the health risks are even higher, I've heard, than smoking, because you don't realize how much you're using, how much nicotine you're getting. That's all I understand. But I work a lot with community health to promote their programs and to promote their Healthy Woman program. We're actually teaming up with the Y this winter for a Healthy Woman, Healthy Heart program, and then we'll have the Healthy Woman Spring program coming up. We just did an event at Colonial Gardens for our Healthy Woman members. So I get involved in that, and I sit on their Healthy Woman Advisory Committee.
So from a philosophical standpoint, a healthcare philosophy standpoint, from what you're saying, Susan, it seems like the Tower Health System is very prevention-oriented. Is that right?
Yes.
Rather than just treatment-oriented. Obviously, it's treatment-oriented, but also having an emphasis on prevention and education.
Yes. I mean, the goal of any large healthcare institution, it should be to keep people out of the hospital. I mean, sure, we're in the business of caring for people, but we want to care for them in the right way. So there's a lot of emphasis on prevention and a lot of emphasis on treating your disease at the earliest stages, or your condition at the earliest stages. I don't like really saying the word disease. I mean, treating your health condition at the earliest stages. So the goal is to shift everything from hospital-based to outpatient-based. So, you'll see a lot more outpatient procedures so that the hospitals can be reserved just for the sickest of the sick. So Tower Health recently just bought Premier Urgent Care. So now they're called Tower Health Urgent Care, and that's another way to push people out of the ERs, because the emergency rooms are, pretty much overpopulated. So think about emergency rooms. They were built for handling 20,000 people a year, and we see 35,000 people a year. So, and so you try to manage those patients in a efficient manner. But one of the ways to do that is to push the less sick to urgent care and treat them there rather than at the hospital.
While we have some time left, I'd like to get into also talking about the recent needs assessment that the Tower Health System has done throughout the system, actually. But could you speak to the needs assessment that was recently completed here in the Phoenixville community?
Well, I've seen the preliminary community health needs assessment that you probably know more about it than I do, because you sit on the committee. But I've learned that there's been about 4 or 5 areas that they identified that we need to address, and a huge one is patient access. And that goes back to the urgent care centers, being a point of access for people, getting people into to see a physician quicker, getting them in to see a new physician quicker, because we all know if you go to somebody the first time, you could have a 4 to 6 week wait time. Well, that's unacceptable. You want to cut it down to within a couple of days, and then if you're already an existing patient, you want to get that within 24 to 48 hours for an existing patient to come in. So that's one of the big needs. I heard behavioral health is a big need, so there's big emphasis at Tower Health to develop a huge behavioral health program. So more to come on that, and it's very exciting.
I found it interesting when I attended the meeting last week about the needs assessment results, that there was almost a 95 to 100% congruity between the needs assessment that was recently completed by Tower Health and the needs assessment that our own foundation did in 2017,
exactly. Yes.
which also indicated that aside from the lack of affordable housing in our community, there was a great need to pay more attention to mental health and substance abuse issues, particularly opioids. And the fact that in the Phoenixville area, that we really need to pay more attention in a preventive kind of a way for heart disease, strokes, obesity, hypertension, and that kind of thing. So we at the foundation are actually looking forward to an opportunity to really work more closely with our health system, since both needs assessments were so congruent.